Hello everyone, my name is Priya Singh Rangey. I am an assistant professor at LG Institute of Physiotherapy. In my previous video, I had discussed about the various physiological effects of heat, and today as a continuation, I'll be talking about the various therapeutic effects of heat. Now starting with the therapeutic effects, the first one being encouragement of healing. We know that when we apply heat, there is an increase in the amount of blood supply to the local area. This increase in blood supply leads to removal of the debris that occurs secondary to any injury to the tissue. Also, with the influx of blood supply to the area, there is again an influx of various nutrients that are required for healing, along with the different factors that are required for healing. And also, heat leads to an increase in the cell membrane permeability. Also, it causes an increase in the metabolism, thereby leading to an encouragement of healing. Heating can also be used to control certain infections, as we know that the dry methods of heating, like say IR radiations or UVR radiations, we know that infrared radiations of the C type and UVR radiations of the C type both have abiotic effects, that is, they can be used for killing certain microorganisms. Thereby, we can use these modalities in order to kill the surface bacteria that might be present, hence leading to a control of infection. The third effect that is produced by heat is relief of pain. We know that heating leads to an increase in the metabolism, heating leads to healing, heating leads to an improvement in the local blood supply, removing the pain-causing metabolites. All these different factors lead to a relief in the pain. There is also a reduction in the muscle spasm. Muscle spasm, as we all know, is something that occurs because of increased activity or hyperactivity of a muscle. When the muscle becomes tired, there is accumulation of lactic acid within the muscle. Also, there is a reduced supply of oxygen to the muscle, leading to muscle spasm. When we apply heat to any muscle, because of the increase in the blood supply, there is an increased amount of oxygen that is being supplied to the particular muscle. Also, with the increased blood supply, there is increased removal of the accumulated lactic acid and various other metabolites as well, thereby reducing muscle spasm. The next effect that is produced by heat is sedative effect. We know that heat encourages healing, it reduces pain, it reduces muscle spasm, hence giving a sense of well-being to the patient. It also helps in calming the nerves down, hence it gives a general sense of relaxation to the person, leading to a sedative effect. There is also an increased range of motion that is seen secondary to application of heat. This is because heat leads to an increase in the extensibility of various muscles and ligaments. Because of this increased extensibility, the range of motion which these ligaments and muscles surround increases. Heating can also be used for the prophylaxis of pressure sores. Pressure sores, as we all know, occur secondary to a decreased blood supply to a certain area because of long-standing pressure to a certain area, usually over bony prominences. There is compression of the tissues that lie between the surface on which the person is lying and the bony prominence. This compression of the tissues leads to reduced blood supply. Reduced blood supply leads to inadequate nutrients being sent to that particular region. Because of reduced nutrition, the tissues gradually begin to die, leading to pressure sores. This can be improved by application of heat, because we know that heat is going to lead to an increased blood supply, hence an increase in the nutrients that reach the various tissues. Hence, we can say that heating improves the nutrition supply to the particular tissues, thereby leading to prophylaxis of pressure sores. It can also be used for reduction of edema. Edema, we all know, is the accumulation of fluid in particular tissue. This accumulation of fluid occurs because the tissue is not able to drain itself. The supply is not adequate to drain itself. Heat, as we know, it leads to an improvement in the blood supply, also thereby reducing the accumulated fluid in the particular area, hence reducing edema. Also, because of heat, there is a reduction in muscle spasm. Hence, we can lead to activity of these muscles more effectively. Hence, these muscles can also be used for creating a pumping action, which ultimately also reduces edema. Heat can also be used in certain skin disorders, like we already know that UVR and IR are used in certain skin disorders for healing or inhibition of DNA replication, like psoriasis, vitiligo, eczema, etc. Heating can also be used as a precursor of other treatments, as we know that it leads to pain relief, it leads to reduction of muscle spasm. Then hence we can say that if we are applying any heating modality prior to any other treatment, it can lead to better efficient treatment of the different joints or the different pathologies. Say if we are using heating for low back pain, if we are applying the heat prior to any other exercise that the patient is going to do, the patient is going to have reduced pain, and hence the patient is going to perform those exercises more effectively. Heating can also be used before the other treatments in order to improve the extensibility of tissues, as we know that it increases joint range of motion. Hence we can use it as a precursor to treatments like mobilization or different stretching techniques, so that we have improved the extensibility of tissues, and then again we are providing stretching or mobilization, hence the treatment becomes more effective. So these were the various therapeutic effects of heat. Thank you.